Let's see how this affects the gait cycle. We're going to begin the gait cycle with heel strike. And we heel strike in supination. Plantar flexed, inverted, internally rotated. That's why we wear out the outside of our shoe. Patient comes in and says, I'm wearing out the outside of my shoe. I say, good for you. That's a good thing. What I want you to observe is that the axis of the subtalar joint actually exits the foot on the plantar posterior lateral side of the heel, right at the point of heel. That's not an accident. That's a brilliant design, which we'll go over in a little while. Well, Root, Orion, and Weed, like all good researchers, decide to make a graph. And arbitrarily, let's put supination on top, pronation on the bottom, and let's define the x-axis as neutral position, which of course represents time. They looked at the subtalar joint during the gait cycle, and here we've isolated the stance phase of gait. And you'll note that we heel strike in considerable supination. Let's combine their graph with the secret life of the subtalar joint that I just showed you. We heel strike in supination. The anterior facet is level. The momentum of the body comes down and hits a cone-shaped posterior facet. You want to rotate, but you can't. So you slide forward and medial toward the middle facet. You begin to load this middle facet and evert the heel. This happens very early in the gait cycle. Then you begin to slide down the tilted anterior facet, and right about here you fall off. What stops us from pronating? What actually stops us is a ligament. There's a spring ligament, or calcaneonavicular ligament, that goes from the sustentaculum tali to the navicular. And the head of the talus lands on it and acts as a shock absorber. It's important to absorb shock. Why? Some studies show